My name is Dr. Jasmine Vayalil. I practice family medicine and I work with the Franciscan Physician Network. I decided to pursue medicine because I had a lot of close family members and friends that were in healthcare, so that kind of sparked my interest in it. When I was an undergrad, I did a lot of shadowing in inner city Chicago in family medicine actually, and that's where I kind of fell in love with primary care, just seeing how those providers were a great resource for the patients there who really struggled with access to healthcare. I love my specialty because it incorporates a little bit of everything. So whether it's cardiology, women's health, mental health, I like that it not only focuses on treating illness, but also prevention, which I think is huge. And I'm able to see everyone from kiddos to older adults. And then, because it is all encompassing, you never really know who's gonna walk in the door with what concerns. So it keeps you on your toes, and I feel like I learn something new every day. When I was in medical school, I remember there was a talk at the beginning of medical school that we had, and I hope I don't butcher the quote, but our dean at the time shared with us this quote that goes, your patients don't care how much you know until they know how much you care. That idea is very true, and that's kind of a philosophy that I try to embody in my practice. So just patient-centered medicine, kind of being a partner in healthcare, team approach is like really big for me. And then another thing that I like to emphasize is kind of how important mental health is to your overall health, and that mental health and physical health are interrelated. Not to be shy about bringing up those concerns. I think I can't stress enough how prevalent of a concern it is, and kind of just treating the whole mind, body, spirit. So when I'm not busy being a doctor, I enjoy spending time with my family. I'm the oldest of 3 kids, very close-knit family. We have a golden retriever who's a major ruckus, spending time with friends, my husband. I love food, so trying new restaurants is one of my favorite hobbies. I love being outdoors or just even going for walks, getting kind of a breath of fresh air. I like comedy shows and podcasts, and honestly, just simple things like that. So as far as technology goes, at Franciscan, I think the virtual translation services that we have are very helpful. Obviously, we see people of all different backgrounds, so if English is not their preferred or primary language, it always helps to have that translation service. I do have like a patient that I see in clinic as well, where we have like in-person translators come in to help with sign language, and I think that's great. And I think the EMR that we have, the Epic, is very user-friendly. It's a great interface to kind of streamline conversation between patients and providers. And I have a lot of patients that communicate with me through the MyChart, so I think that's very helpful.